kick off our afternoon, I have Michael Bowering, Applications Analyst, and Jillian Mattson, Nurse Manager from Gaylord Specialty Healthcare. Michael brings a wealth of knowledge and experience. He's a tremendous resource with over 15 years in a variety of roles. In speaking with Michael, he was very excited to be here with us today. Jillian is the nurse manager of the stroke unit at Gaylord Hospital. She is a compassionate and detailed-oriented registered nurse with extensive experience in patient care and team leadership. Please join me in welcoming these two to the stage.
All right, hey everybody. We just want to start off by saying we're really thankful to be here, and we wanted to say thank you to Connexall not only for having us here, but also providing solutions for our needs at our facility. So thank you guys very much. Thank you. All right, show of hands, how many of you guys are still using paging hardware? Okay. This is why we're here. We'd like to share our story with you, how we're able to finally squash those pagers. We're done with those. All right, so we value your input, and we want to do this a little differently, right? So we'd encourage you guys to ask questions as we go. Stop us, interrupt us. At the end of the slide, just poke your paddle up, and we'll try to address everybody, and then we'll try to save some time at the end as well. So feel free to chime in. All right, so I'm Mike Bowering. You can call me Mike, I'm sorry. And I was the lead on this project. And as you can tell, I'm a little bit nervous. I get that from my dad, so I'll settle in once once I get going here. So, but yep, that's about it.
I'm Jillian Mattson. You can call me Jill. I'm a nurse manager at Gaylord Hospital. I'm equally as nervous, so the organization sent potentially the two most nervous people here, but we'll do it.
Absolutely.
But I have worked, and if you couldn't tell, it's like our 100th time speaking. So.
Yep, absolutely.
But I started working at Gaylord 8 years ago, and I have a unique perspective, I think, because I started as a floor nurse on a brain injury unit, went to charge nurse, did a little bit of per diem supervision, and now I'm in a leadership role. So this is our lovely hospital. So Gaylord Specialty Healthcare is located in Wallingford, Connecticut. So we are anchored by a 137-bed hospital. We have 5 outpatient sites and the only transitional living facility in Connecticut. Our patients' average length of stay is about 3 to 4 weeks, and what we do is we prepare them for their next level of care, whether that be home or transitioning to a skilled nursing facility. Aside from patient care, Gaylord Specialty Healthcare is very passionate in education, research, and community integration. So we are among the top 20 of the largest rehab providers in the nation, and we are the only facility in the United States that has CARF accreditation in all 3 specialties, which are brain injury, spinal cord injury, and stroke. And what you'll see here is a picture of our inpatient gym, and this is just a fraction of what we can do there. We have a car in the gym, we've got a grocery store in the gym, we've got washers, dryers, you name it, we have it for the patients to use in order to integrate back into their activities of daily living. So our overall mission, right, is to enhance health, maximize function, and transform lives. And we, pride ourselves on clinical excellence, compassion, integrity, respect, and accountability, as well as a commitment to safety. So those are what we call, and our I-CARE values, which each of our employees possess no matter what discipline they're in. Each of our patients is going to expect to do 3 to 4 hours of intensive rehab a day. So they're really here for a very high rehab accommodation. So this picture on the screen is one of our previous patients. She allowed us to share this. Her name is Jillian, and she's paraplegic. So what she's walking in is our exoskeleton suit. So basically it helps her use her muscles, increase her tone so that she can work on actually walking again.
All right, so the purpose of this slide is just to let you guys know that we were really busy in 2024, but this presentation is about WorldConnex. So move right along. So from beats to bytes, right? We were able to trash those pagers by using WorldConnex. And this is how we did it, right? So actually not how we did it. Our goal was to move to mobile computing. The objective was to replace the multiple devices that our clinical nursing staff were carrying and make them into one. The benefit of this is to reduce tasks, reduce clutter, and simplify tasks. And also, we want to support bedside medication scanning, point of care, messaging, all on one device.
So Gaylord struggled for a long time with interdisciplinary communication, and I can say that confidently, being a floor nurse who experienced the breakdown in communication and is seeing it in a leadership role too. So we have certain regulatory compliance measures that we have to meet. We have to give our critical lab values to our physicians within 30 minutes. We have to have our interdisciplinary team work very closely together. Also, our lack of communication was resulting in poor employee engagement scores. There was delay in patient care, transporting patients, you name it, we had some sort of delay in it. And again, I mentioned earlier that the patients are here for therapy, so if you delay their therapy, that's kind of effectively taking away what they came to our hospital for. And it created a lot of wasted time for our nursing staff. So what would happen is we would have to do a one-way page to the physician and wait at the nurse's station by the extension we gave them and hope that we would be there and not be called to another patient's room. And it became really difficult. And healthcare climate is difficult already, and there's a lot being put on nursing and other people in healthcare too, but nurse burnout is a real thing, right? And sometimes ineffective communication can be just like the straw that broke the camel's back. Like you're having, some of your patients are tanking, they're having acuities, and all of a sudden you can't get your message to the person it needs to go to. It can be a lot.
Okay, so why do we do this? Staff, like we talked about earlier, they were using unsecured texting apps, and this was a major risk. Email is not practical. I've never seen a nurse sitting on email at our facility. It's just not practical. All right, so I have another question for you guys. Who here encourages the use of their own devices, BYOD, at their facility? Okay, more than I expected. That's awesome. We wanted to do this for a number of reasons, mostly cost savings. So to solve these problems, right, we switched to WorldConnex, right? So staff's using WorldConnex on our SpectraLink phones and on their personal devices in the business side. Simplified secure messaging via WorldConnex, and again, so we'll get into this later, but we did purchase a small amount of SpectraLink phones for our nursing staff specifically, so more to come on that later. All right, paging, right? So we had challenges with paging. We're using Stone Age technology, right? Paging transmitters, big antenna on the roof. This was very costly. We were leasing physical pagers, two different kinds, one for in-house, one for out of the facility, and they were often lost. And the reason we wanted to go with BYOD also was because staff takes care of their devices. They were breaking these things, smashing them, sending them through the laundry, dropping them in the toilet, you name it. So, we were also managing multiple systems in two different places. It was so complex, confusing. People coming in had no idea what was going on, and it's really hard to teach that. So, and on call, we were updating some groups weekly who's on call on Sundays sometimes. It was a mess. So, to resolve these issues, we went to WorldConnex, and it allows us to grow. Now we manage the directories in one place in the SAC, and now we have paging groups, so less maintenance required.
Before we had WorldConnex, just like to give you the perspective of a floor nurse, it depended on the day of the week, the time of the day, what division you were trying to contact. So were you trying to contact a rehab division doctor? Were you trying to contact a medical division doctor? Was it, before 7 a.m. on Monday? Was it after 7 p.m. on Monday or through Friday? Was it the weekend? You had to figure out exactly which physician to page to get your needs met for your patient. So I can think off the bat like 5 times when I was on the floor that I would page the on-call MD, and they would be like, oh, that's for the wrong division, and now then you're waiting another 30 minutes for, your patient's need to be met. So using WorldConnex has definitely helped our communication.
Absolutely. And we talked about device challenges. Pagers were often lost, not transitioned to new staff, multiple devices. We talked about nursing staff carrying multiple devices.
Yeah. So we like to think of our nursing house supervisor as somewhat of a superwoman. She has many talents and trades, but she is running from one end of the hospital to the other at any given time, right? So she's in charge of patient flow. She's in charge of every code that's called overhead. She's in charge of staffing, you name it. She's probably the point person. But to Mike's point about multiple devices, she would be carrying her personal phone, a SpectraLink phone, a staffing phone, a pager, a radio, her keys, anything she'd need for, any type of code, you name it, she had it. So she was able to drop at least 3 of those devices once we moved to WorldConnex, so she can run more freely throughout our hospital.
And from my point of view, she's a beast. I would not mess with her.
No, you don't mess with June.
Yeah,
you don't.
No. She,
Anyway, to fix these issues, now staff are just going to the App Store, the Google Play Store, and downloading WorldConnex. We created a short document on how to connect that app to our servers, and it's really easy. So, and this also obviously eliminated the need for multiple devices and all the clutter that was on our countertops. All right, so IT also was managing directories in both InfoRad and AMS Connect. It was confusing, like I said, and not LDAP integrated, so we were managing, creating people manually in both systems. InfoRad was clunky. I don't know how they built it on, and I won't get into it, but DOS, like we said. So pager maintenance, repair maintenance was required. These things were in and out of here. It reminds me of, does anybody remember Netflix when they did the DVD by mail? It reminded me of like we were doing VHS by mail, just using, getting things in and out of here, old technology junk. So we were really happy to get rid of that. And again, this is how we fix that. We manage the directory in the one place connects all, and also the physical hardware has been replaced with the WorldConnex app. So, all right. So, why did we choose WorldConnex? Why did we go with ConnectAll? We're already, like you guys, some of you guys here, we're heavily invested in ConnectAll. We do our telemetry alarm notifications through ConnectAll. All of our Philips data filters in through ConnectAll, and then it sends out alarm notifications. So this relationship made this decision very easy for us. Other solutions were way too expensive for Gaylord. We also have potential here for a single platform for assignments, alarm management, and secure messaging all in one place. And also technical support at ConnectAll, as we all know, is awesome. So props to you guys. Before we get into the project and what we did, how we did it, let me skip to the next slide. I just wanted to show you the SpectraLink phone. We were using 8440 phones, just basic handsets. But there was a lot of stuff going on in these phones, so it made this a little complicated, right? So staff's receiving phone calls, nurse calls, codes, and telemetry alarm notifications on this device. So just wanted to give you an idea of the old technology before we got into that. So we need to do this project in 2 phases. First, we need to replace those legacy handsets with smart devices with an integrated barcode scanner. So this is a big project. We did not, I'll get into this later, we didn't have an MDM solution at the time, so we actually had to hand touch every single phone and side load WorldConnex and other applications onto it. And we rolled this out in groups, department by floor, and this is just our nursing folks. And we purchased these 92 series SpectraLink phones through ConnectAll, and that was awesome. So that project took about a year. So that was phase 1 on the hardware. Phase 2 on the software, it's not on the slide here, but we did have to make it so our guest network, that WorldConnex could work on our guest network. So that was kind of step 1. Thanks, Boris, for this tip, but we had to update our access point controllers before we did anything. So that was a little bit of a project. Then we worked with professional services at ConnectAll. Kevin, who was great, helped us with system config. And then we created 3 unique URLs, one for 2-way messaging,
one for web paging and one for our critical groups. So that was phase one of the software. Phase two, and this is why we want to keep this discussion kind of open, right? It was much more complicated. We needed to create buy-in. We needed staff to adopt this new system. Nobody likes change, as we know. So what we did was we had to educate folks. So how we did that was we identified a few super users in a few different departments, right? And they downloaded the phones. We were communicating with them, and this one went around for some time. And the voice of those end users was critical. So anyway, word spreads like fire at Gaylord. So
we like to call it as the Gaylord turns.
Yeah.
Yeah.
Absolutely. So, once somebody says, you use WorldConnex yet? Oh no, what is it? The rumor is spreading, right? So IT didn't have to do much in terms of getting the word out there, right? So it was great. That magic word there, pilot. We did a pilot with nursing. There were some challenges with nursing, and I will discuss that in our lessons learned. However, we did do a pilot, and we learned a lot. We corrected a lot of issues. For example, the SpectraLink phones, we initially gave to staff the option to just select their own ringtones and alert tones, and this created a lot of excessive hospital noise, as we talked about. I describe it, I would walk on the floor, and it sounded like a casino in there, but there was no winning going on, absolutely not. So aside from that, we encourage personal devices. And then I don't know if you guys had this at your facility, but some people are like, I'm not using my personal phone. That app, what is it, tracking me? We had a lot of that at first. Mm-hmm. And some people are like, they refused. So, and there were certain groups like EVS where it made sense just to give them a dummy phone. It just sends messages in and out with WorldConnex, does nothing else. So we did provide devices to those folks. And then we ran infrared AMS and, WorldConnex in parallel, just to make sure everybody's receiving their alarms that they expect. So anyway, I'll get into our nursing story later, but we just basically flipped the switch. We said, hey, this is going to happen whether you like it or not. Here's the information, take with it, roll with it.
And we heard a lot of people, say yesterday that when you do a project, you have to make sure that you're doing it with nursing, not to nursing. And I want to give Mike some props because he really did do it with nursing, not to nursing. So on our one nursing unit, he identified 3 nurses to be the super users, right? And effectively it helped to control failure and success. But more important than that, he was able to take their feedback and then just kind of adapt as he needed to, like throughout the whole the progress of the program, right? So then those 3 nurses told all their friends, like we said, because word spreads like wildfire, but they were able to help educate the staff. So it really, effectively gave engagement and buy-in because they see their 3 nursing friends really liking a certain thing. It's adding, value to their job, taking away from their workflow and allowing them to be nurses, right? Because essentially nurses want to just take care of patients with the least amount of barriers. So I think you deserve a little, props for that, Mike.
It worked for everybody. That was good. Yeah. So, we couldn't have done it without those 3 nurses, to be honest with you. They really feed off of each other. They have a lot of power, if you will. So once they were in, everybody else was in. All right, so this is what winning looks like, right? Right away, we noticed improved communication. Staff were communicating with each other, especially interdisciplinary communication was improved. The easy-to-use software made it so reduced IT dependence, right? So they no longer reach out to IT for help. They take the app, they use it, they know how to use it. It's simple. As a matter of fact, it's so user-friendly and the prompts are simple enough. It makes people more independent in our facility. They're taking chances, they're trying things out, and this has also impacted the culture at Gaylord. People have more of an I-can-do-it-myself attitude, and that's what we need in healthcare, and that's why we went with ConnexAll, and the data will speak to the adoption. I'll show you in a slide in a minute. It's also, again, note, we still have the option for one-way paging. Most people prefer to use the two-way communication or group messaging option. So. All right, what do we observe? High adoption. Staff actually, more people are using their personal devices, which is what we want. So
And again, we were hoping by providing basic dummy phones to those folks that did not want to use their personal devices, that they just get bored of having 2 devices after a while, and then I'll just use my own phone from now on. So, and then also there's desktop access. They can use WorldConnex on the web. We use Google Chrome, but I think you can use that on the edge and everything else too. So, and high satisfaction, positive feedback, no complaints. And again, different business areas are now creating their own use cases for the tool without needing IT support. They just take it and integrate it into their workflows. So one example I saw recently that our inpatient therapy staff, they have a group conversation with 60 people in it. So it works for them. I don't ask, we don't care, to be honest with you. They just take it and they do it. So, which is what we wanted. So on-call is much better. We're not managing, we're messaging groups rather than individuals, and on-call resources is much simpler.
And we have a lot of senior nurses at our facility. We're pretty lucky to have them as resources, but like they're, the nurses that are used to doing paper charting and using, index cards and med carts, like they've seen Gaylord through all of their, progression, to future, to where we are now. Even those nurses had no trouble just jumping right on and using WorldConnex, and sometimes they tend to be the ones that are a little more reluctant to change, and they would tell you that themselves, that they are set in their ways, but they even really liked using the program.
Yeah, when I first started, I went up to Jill's unit, her floor, Hooker 1, that she manages.
We're a tough crowd.
I don't remember her name exactly, but she was definitely old school, if you will. I was talking to her, and I think she made a comment, "I don't know what a Windows is." I was like, okay.
That's we call her Dr. Pat. Yeah.
So we're getting better. So data. All right, everybody loves data, right? So we picked one random day, and just wanted to give you an idea of the usage at our facility. We picked October 2nd. Let's see. On the X, we have timestamps. We go from 7 a.m. until 6 p.m. And then over here is our number of messages sent or broadcasted. So as you can see, we peaked at about 160 messages at 12:05 p.m. We also see a spike at 8:15 a.m. at about 140 messages. And then over here at 2:40 and 2:30, about 135 messages each. So this data just speaks to the adoption.
And our hospital's a little bit unique. So we have medically complex patients with a rehab need, right? So then they have their intense rehab Monday through Friday, and then it's a little bit of a lull on the weekend, but you can see where it spikes at 8 a.m. is about where the patients are starting to get up, get ready for therapy, and the doctors are starting their rounding around then. And then at noontime is typically when they come back from their therapy. It's lunchtime, they're getting all their needs met. Sometimes the doctor's coming back around for a second round. And then at change of shift is usually when therapy will taper off, they'll come back to the unit, and the doctor might come see them again, depending upon what their acuity is or what their complexity might be. And then you'll see in the earlier morning or later in the evening time, it dies down. But it speaks to how effective our communication needs to be, because on night shift or, towards the evening shift, you kind of run on a skeleton crew, right? You've got your one nursing supervisor, you've got your one in-house physician for all 137 beds, and then depending upon your unit, your matrix might change to have less nurses, less aides. So it's really important that if you have to get a message across, you can do it with the minimal amount of time and efficiently, and WorldConnex allows us to do that. So these are our clinical wins. And this part is very exciting for me. So we usually take our admissions off hours. So they come somewhere between 3 and 9 p.m. So one of the biggest wins we've had with WorldConnex is improved medication reconciliation. So for us, when a patient comes in, they see their nurse, they're assessed by their nurse, and then the doctor comes in, they'll do their assessment. And then comes the floodgates open, and you get all the orders and the medication, and you're ready to do their evening med pass, right? But oops, their medication's unverified. and that's not what they came from the sending facility with, and so this way we're able to easily talk to pharmacy. We can say, hey, this isn't what was given to us from the previous hospital, or the patient would prefer this, or can you verify this medication for us? And they do it instantaneously. So not only does it help the nurses, but it shows the patients we're a reliable facility, right? You have a need that needs to be met, and no matter what time of day you come, we're going to try to make sure it's right. So you get your right medication at the right time, the right dose, all of that. And equally, we have faster turnaround time for our critical labs. So like I mentioned earlier, we have a regulatory compliance measure of reporting our critical labs within 30 minutes. And we were not doing so hot before WorldConnex. Honestly, we put it on our unit scorecards as something that everyone pays attention to, so it becomes on everyone's radar. And we have improved documentation and compliance around this now. And then all of this ties into, improved patient safety and patient satisfaction. So when patients feel like they're heard and we're taking care of them better and we're keeping them safe, they're going to be satisfied with their stay at Gaylord, and then equally so is the staff. All right, Mike, you can change.
Patient satisfaction is also improved. We take patient satisfaction very seriously at Gaylord. Dorothy does surveys with the patients. Mm-hmm. I don't even know how often, but we saw a bit of a spike after WorldConnex came out, that things were just better. So.
We have patient advocacy too, which I am honored to be one of them. And I do have to say that there's less patient advocacy calls because things are just handled in the moment. It's not boiling over. There's not, waiting to find a solution. We hear about it, we fix it. And this is our, this little picture is what our switchboard has to use. So we have any one of these calls can be used throughout the day. So whether it's a code blue, we have a signal 1 would be for a missing patient, a signal 5's for a down system of some sort. Now switchboard's able to use this quickly and send the message off to who exactly needs to respond to that. And so it'll go to the right, call group, as it were. And everyone will come as soon as they can.
Yeah. And for the tech guys out there, this was sort of a side project. We used the WSC to create this, but we think it came out really nice. It's much improved from what we had with infrared. So, all right. So obviously, right away, improved communication. Staff are finally communicating effectively. They're no longer working in their own silos, right? So also improved usability. Previously, to page somebody, it involved finding a data entry and typing a message, clicking send, and again, we didn't know if it was sent, received, or read. So we have that now, and it's very valuable. It holds people accountable. Better provider communication. Mm-hmm. That's what I have to say about that.
And for example, where our patients, if one was ready to go to therapy, the therapist calls, first they would start with the secretary. They'd call the secretary, say, okay, Mrs. Smith's, we're ready for her to come down to PT. Then the secretary would have to find the nurse, hope that the nurse isn't in a room, maybe elbow deep in something. And then by the time they come out, they take the patient to therapy. Their therapy was at 8 o'clock and it's now 8:25. So they've missed the majority of their therapy. And again, we're a therapy-based hospital, so effectively it kind of took away from what they ultimately came here for. When people are admitted to our hospital, we always ask them, what's your end goal? What are you looking to get out of your stay at Gaylord? And it's always to go back to their baseline function or to get home. So it's imperative, really, that we are able to get them to and from their therapy and communicate, again, effectively so that they can enjoy the most of their stay.
All right, so I crunched the numbers. For those that are math wizards, I think we're paying $60K a year for both AMS Connect, infrared, and leasing those pagers. So we estimate about a $25,000 a year cost reduction, 40% in savings. Also, reduced hardware, reduced IT dependence, no longer need for resources on certain things. So, and it's just more efficient for everybody. So it's just a win-win. All right, so lessons learned. Before we went live with WorldConnex, we ran into an issue. So before that pilot, so it took me a while to get WorldConnex onto these SpectraLink phones, right? I do everything manually one by one. The app wasn't even really ready for us yet. It took time. It took a year to get that done. When I finally got WorldConnex on one of those phones, I took it to the nursing floor. I scheduled a meeting with our team, those super users, and our CNO. And I'm like, all right, let's test this out. Let's send an alarm and see what happens. It's going to come over across like a notification. It's going to look great because right now that web API is pretty hideous. It takes up the whole screen. Staff doesn't know how to get out of it. So anyway, I handed her the phone. I said, okay, go ahead, log in. And she said, whoa. I have to log in now? It's like, well, yes. It's just your network credentials, same as Meditech Expanse. What's the big deal? Significant change to their workflow, right? So there was a fear, I could call it a fear, that not only if staff didn't forget to log in the morning, this comes to mind, like what if their password's expired and all the steps that they have to take to get that fixed. So potential to miss a critical telemetry alarm notification. So we didn't know until we had it in our hands. So we can talk more about that.
I think it's important, too, that during the time Mike started to introduce this to us, our nursing department was in like a cultural shift and a process change. So our nurses were used to coming onto their shift. The secretary would hand them their phone. Their assignment would be preloaded by the secretary. And they would just go about their day. They didn't really have to think about it. They just knew the calls came to their phone and everything was, hunky-dory, I guess. But we shifted it so that they took the accountability to signing into the phone, because we were finding that some nurses, some aides, they weren't taking phones, right? They would be signed into them, but they weren't, carrying them on their person or taking them from the nursing station. So in order to get them to, engage with the phones more, we had them sign into them. But they were already kind of thinking, it's daunting to set my assignment up now, and now I have to sign into another program. I don't think it's until they really started using it that they understood that it gave them time back and improved their workflow rather than hindered it, which I think is really important, because if you would go back to our hospital today and ask any one of the nurses, they would say that WorldConnex has been an improvement to their workflow. So.
Right, and we'll get there eventually. We'll reunite alarms and all that. So moving forward, right? So we paused the project until I could come up with a solution, and that was to create an additional directory within WorldConnex and Connexall, which I manage and I manually create. Every nursing user that comes in and out of here, not a huge problem, and this is just temporary until we can make it so those alerts come across the phones. And again, I mentioned mobile device management. If we were to do this again, we definitely would have rolled out an MDM before anything else. But we wanted to get this project rolling, so those are lessons learned part 2. All right, so let's revisit the goals. Yes, I believe we've met our objective, right? We replaced those multiple devices with a single device and clutter reduction here. Benefits that we perceive, tasks are much simpler, and communication is definitely better.
I think we work less in silos too. Nursing kind of understands what IT does, and IT, understands what nursing does. Because I think, any of the nurses out there might say that when we're on the floor and there's a problem, we're like, we need it fixed now because, it's critical to our patient. And not thinking about all of the things that go into fixing one of our problems. But Mike is very nice to us in nursing and helps us, so.
Absolutely. Also these devices, they do support bedside medication scanning, although we're not there yet with our clinical workflows. And yes, point of care and then secure messaging on one single device. So we're very satisfied with that. Future goals and projects, here's our wish list. Automatic work schedules in WorldConnex. If we could set automatic work schedules, it would actually eliminate the login problem, I think. Well, in theory, right? So it definitely would make on-call better. At the end of the day, you have to, log off. Otherwise, you're going to get that alert all night. So automatic work schedule would be very cool. We do next steps, best steps would probably be nurse call integration. And then, of course, we'd like to reunite the alarm notifications. And so integration with our EHR would be awesome. And automatic assignments. There's been a lot of talk about assignments here, and it's a big question mark at our facility. We were brainstorming, and obviously we already do our care team and Expanse. So if Connex all could piggyback off of that, even though we know Expanse is a downstream application, but we'll see about that. Also, I don't know, does anybody here use UKG for punch-in? Okay. Yeah, we set our schedules on there too. So again, if telemetry assignments could piggyback off of that, that would be awesome. And then eventually, move to 100% mobile computing. Thank you. Questions?
Thanks, guys.
Hi, great job, guys.
Thank you.
You guys did really good. I have a couple questions for you. I'm Steve with Scripps Health. And number one, you completely removed your environment away from pagers. Do the physicians also carry devices with WorldConnex?
Yes, they do.
So what kind of deal with the devil did you make in order to get them to sign in to the WorldConnex?
Fair question. Well, they were part of, the dreaded pilot. So, and then I don't know that they had a choice.
We strong-armed them, for sure.
I don't know. Like, it was one of those, you're on the ship or you're not.
Yeah.
Yeah.
And my second question would be, I noticed that you mentioned that you manually create your users and their devices in the WorldConnex. That in itself can be a full-time job.
So just our nursing users, the rest, the business users and the docs and even our LDAT, that's done auto device creation.
Gotcha.
But the idea here was, and it's a theory that, if nursing needs to log on to WorldConnex, we're already getting this web API coming across. They're going to get duplicate alerts. So if they want to use messaging, they're going to get duplicates. Like, there's no question about it. So that was the idea behind it, and that's the solution we came up with. And it's down
All
there.
right, thank you.
Yep.
Hi, Molly Salvaggio with Stanford Medicine. At our hospital, we actually have several backups in case the communication fails in one application. I was wondering if you guys received any pushback from the doctors or your rapid response team relying on those backup notifications in case an application fails.
We haven't gotten any pushback, but it doesn't just go through WorldConnex for our rapid response or our code blue. So anywhere, if you push the button in the room, it's going to go to the phone regardless, and then the nurse will call it overhead too. So it's kind of like a 3-step process. But even if if EVS is cleaning and they accidentally hit code blue, it's going to alert a code blue to the team that should respond to, and so there's a couple fail-safes built in.
Okay, thank you.
Yeah.
I'm Amira, I'm with Connexall, and I have a question. I'm talking to a hospital system right now that is talking about doing BYOD, but they're getting a lot of pushback from their employees, and they're talking about installing something on their devices that would make it, they can't access, social media, Instagram, whatever, while they're at work, and they're concerned that they also won't be able to do that when they leave. Did you do something like that? What was it? How did that work?
We had something in place for years that the only requirement, if you put your Gaylord email on your phone, you have to put a passcode on it. That's the only requirement, and that's been in place for long before I even came in. But in terms of Wi-Fi and connectivity, no, none of that. The workstations are locked down, but personal phones, no, not at all.
We go on the honor system like you're at work. Let's hope you're using.
They don't want to do that.
I also wanted to mention too, I don't know if anybody remembers in biomed, there was a myth that cell phones interfere with the biomedical equipment. I don't know, it's just something I learned over the years, but that's a myth. And Gaylord used to have a 0 cell phone policy, and so it was a major change for our facility. So.
Yeah, I think our stark change from absolutely no personal devices to having personal devices, there's still a level of respect and for the policy that we hold, maybe.
Russ Huglett from UCSF Health. Can you elaborate a little bit more about managing the directory and the SAC? Is that just like the units and stuff, or are you importing like Hitachi and PeopleSoft, and you actually have a directory?
Right. So in the SAC, or it's actually, yeah, it's in the SAC. We have 3 different directories. We have one for our, so assignments are done in Nurse Call, which is Responder 5, and those assignments actually trickle down to telemetry assignments. So we have a directory for Responder 5 in ConnexAll, and then we have a directory for our paging users, which is LDAP integrated auto device creation, and then the nursing users are manual created, and there's a directory there. And I just simply right-click it, and I create a device, and then create a user in that directory, and then join the device. You know, it's like you discussed earlier, this gentleman over here talking about working the DAC, that kind of work. So hopefully that answers your question.
Eric Glassbrenner from Mount Sinai Medical Center in Miami Beach. Great presentation. I was very happy to see a rehab hospital here. That's my clinical background.
Oh, very nice.
For rehab nurses. Have you had any feedback from any accrediting bodies like Joint Commission or CARF about the security concerns of people using their personal devices?
Not currently. So we just we just got our CARF accreditation, and we also just had our Joint Commission visit. Yeah, and during Nurses Week, no less. So, yeah. But it was that we had fantastic visits, and they didn't have much to say about that. But on the nursing units, they do use the SpectraLink devices, so they're less apt to use their personal device, just because of contact precautions, things like that. So,
Cool, thank you.
yeah, thank you.
Ruben DeSala, Stanford Children's Health. In our environment, we do have labeled phones just to distinguish between a personal phone and a work phone. Was there any patient feedback saying that the clinical staff or providers are on their personal phones with personal conversations? How did you guys get around that, if that was an issue?
Not on the nursing units, no. So, and again, I think it's a little bit more that we use the SpectraLinks for our department therapy uses personal devices a little bit more. But to that effect, I do manage the SpectraLink kind of inventory, I guess you could say. So they're each labeled to the unit they belong to with a color, so it's easily identifiable that it is a work phone. And then some
how
of
about
our
the personal devices that are on, for the app?
I haven't heard of any patient complaints, but again, like on the nursing units, it's mostly just the SpectraLink, so they're not having their personal devices out. But I haven't heard anything from therapy either. Yeah.
I will say I do catch people walking down the hallway, and I almost bump into them, so that's my complaint. So
We have